We are talking today with Beth Purcell, Vice President of Business Development and Strategic Planning at the recently rebranded Reading Health System.
There we go.
Beth, thanks for taking time today.
Great, great.
I am, well, in the news recently was the story about the FTC saying no to your proposed merger with the Surgical Institute of Reading. What happens next, and where will you go from here now?
Sure. I believe it was in May there was announced that it was a venture with the Surgical Institute of Reading and Reading Hospital to merge. What transpired on Friday of last week was the FTC and the AG's Office of Pennsylvania challenged the merger and dictated increase in cost and some lack of quality. We believe that this is completely not the direction that merger would have helped. It really would have assisted the community in extending out our quality of care and really brought the surgical specialties through the whole continuum. With that being said, it's a very disappointing process, and so we have chosen to walk away. If we went and challenged, it would have meant more or less many years in courts. So we think it's very prudent that we just kind of, stay back. It's unfortunate that venture will not happen, but we have chosen to walk away.
Was that a surprise, or did you anticipate that could happen?
That was one of the anticipatory conclusions. That was never really put out there as that might be what the compelling issues would have transpired. When this venture was brought to the table again, the Surgical Institute basically proposed this venture with the hospital in May, and that was never thought of, that this would not be good for the care of the community.
Let's talk about you and your position now. This is a newly created position.
Yes.
And you've been here how long?
This will be going on my 5th week, I believe. So yes, I am extremely new.
and you're right in the fire with the new branding and this decision. How does this position fit into Reading Health System's growth strategy?
Great, that's a great question on the fact that right now the Reading Hospital at the Reading Health System is going through a very rigorous strategic planning process. And what that really means is setting the blueprint for the hospital and the system for the next 3 to 5 years. With that being said, growth is always one of the factors on really, let's look at the hospital and its outreach extension. But I think the key point here to really understand is how are we servicing the community, and how is our alignment, and how can we improve that as we move forward. We're really looking at not only growing, but it's really improving the population health. With that being said, this strategic plan is geared towards those platforms. I'm leading the process, and that doesn't mean that we are just focusing on the hospital. We're focusing on our medical practices, our extensions within the community, and really what is the access and how we can improve those lives of the community. We've had, I would say the hospital is at a time that there's many new changes, not only in our payer, our reimbursement, but really as we align with the physicians. We're looking at pulling together a clinical integration product as we move into the springtime, so that will really align the hospital and the physicians for value, an increase in quality and lower cost. So we have many of these different focuses and facets that really are driving what the business will be for the hospital in the next few years.
It can be difficult to make average consumers understand how all these changes are going to affect them. You and I were chatting earlier, and you said we were kind of going back to a time or a system where the physicians were dealing more directly with patients, and it was less about getting volume and more about hands-on and kind of preventive measures.
Right. Really, the healthcare, or I look at the healthcare industry as we're moving now, is truly wellness and prevention, really tying back to what our true mission is. And that is improving the health of the community, or improving the life of the patient. For us to do that, we need to manage or clinically manage that patient up front, So we were talking about now, physicians might actually go back to having house calls. Physicians currently manage their patients within the nursing home. We more or less look at the whole continuum of care. The end-all be-all spot is, yes, if you are really sick, to be here in the hospital. But we're really looking at how we can service the health of the community within the best access point. Is it at their home? Is it a clinic in a certain area? Is it a certain type of services that we're not delivering? To really truly understand what are the health needs of the population and moving that forward, rather than focusing on what is our census or our volume in the hospital. Those days really are moving away. We're looking at what, proving that, the health quality and truly trying to lower the cost of care, not only to our patients but to our payers, which would be the employers in our area.
Because the hospital is the most expensive place to get health care.
Exactly.
If you can deal with people's conditions while they're not so sick, to have to come to the hospital, that benefits the whole system.
I always say the most appropriate care at the right time and the right place. Having an emergency room utilized for a primary care or a wellness visit is not the most appropriate care. But why are we seeing those patients? Is there not truly an access point for them in the community? Or are they not assigned to a primary care physician? So we are looking at all these different new models to really connect to our patient and our community.
One last question. If there was one thing about either the Affordable Care Act or health policy in the United States generally that you could change right now, what would it be?
To change would be an interesting word. I'm really looking at how we can actually, when we talk about the Affordable Care, we talk about health reform, is looking at this new population that will be included within the Medicaid population, and how we can actually build some models to actually reach out to them and not have them service where they're like the last of the last and then ending up in our emergency room. We really are looking at, let's decide what are these new models of care that will deliver to this population. So I'm not saying there's something I'd rather change. I'm actually motivated by, okay, we have this whole new population that we're able to serve and we will be able to connect to, and how can we deliver the best quality care.
So finding the best models that work.
Exactly. And again, there are some current models out there, but we have to be innovative and think outside the box and really understand that we have, it is the whole community, and it's not a portion of the community that we're serving. We are serving the whole community within this whole continuum of care, not just the hospital, but the physician offices, what services we put out for wellness and chronic disease management. And so it's a whole different time of really, pulling apart healthcare and understanding what would be the best for the patient.
These are interesting times in healthcare right now.
Interesting times.
We'll let that be the last word. Thank you, Beth.
Sure. Wonderful.